to introduce Ms. Patricia Tabernero, who is the Antimalarial Quality Scientific Group Coordinator for the Worldwide Antimalarial Resistance Network at the University of Oxford in the United Kingdom. Ms. Tabernero has worked in public health in Asia and Africa with advanced experience in managing teams during fieldwork activities in the Lao People's Democratic Republic, Cambodia, and the Gambia. Ms. Tabernero has been developing and implementing tools to inform the malaria community of the quality of anti-malarial drugs and advocate for improved monitoring of substandard and falsified compounds. She was based at the Lao PDR, the Laos People's Democratic Republic, at the Lao Oxford Mahasot Hospital Wellcome Trust Research Unit in Vientiane. More recently, she has been collaborating with the World Health Organization to develop and update the guidelines for sampling procedures for monitoring substandard, counterfeit, falsified, and falsely labeled products. Ms. Tabernero is a pharmacist by training and holds an MSc in the control of infectious diseases from the London School of Hygiene and Tropical Medicine. And Patricia is a native of Madrid, Spain. Bienvenido, Patricia.
Gracias, Jim. So yes, as he said, I'm Patricia Tabernero, and I'm the coordinator of the Antimalarial Quality Scientific Group at WARN, part of the Oxford University. So WARN stands for the Worldwide Antimalarial Resistance Network and is based in Oxford, but the Antimalarial Quality Group, we were based at the Wellcome Trust unit that the Oxford University has in Vientiane in Laos. And what WARN is a collaborative platform, is a unique resource that what we aim by integrating data from different sources, we want to overcome the challenges of understanding antimalarial drug resistance and provide reliable evidence that policymakers can use. So from the Antimalarial Quality Scientific Group, the main objective is to reduce the impact that poor quality antimalarials have on drug resistance and on patients' health. We want to increase information availability. We want to increase the quality and the quantity of the data. We want to identify the gaps on the current evidence. We want to know what needs to be done. And with that, we want to advocate for more public health attention and to advocate for access of good quality essential medicines. And the way we started, we compiled all the reports of antimalarial quality that were available to us in English, French, and Spanish since 1946. We put all these publicly available reports in a database, and we built the Antimalarial Quality Surveyor. There is a mapping tool that is available at WARN website, that what it does, it maps the different pins are all the reports that are available about poor quality antimalarials. And the Antimalarial Quality Surveyor is important because it shows the alarming scale of the problem, but also highlights the gaps on the current evidence. We also analyze the database that we had for antimalarials, and we found that 60% of the malaria endemic countries, they don't have any report publicly available about the medicines, the data that they consume. So we don't know for 60% of the countries what is the quality of the medicines that the patients take. So what I'm going to present today is what we're presenting in the supplement, that is a repeated random survey that was conducted in Laos in 2012. So this map is a map of Laos, and it shows a survey that was conducted in 2003 in 12 Lao provinces. And this survey in 2003, it aimed at studying the availability and the quality of antimalarials in Laos at the time. It was conducted in the private sector. So what we did is we repeated the survey 9 years later, and it's the first time anywhere that we wanted to allow a statistical valid analysis of the change of the prevalence of poor quality antimalarials through time. So we collected samples from all the pharmacies in 2012. We only did it in the 5 southern provinces because malaria is not endemic in the north anymore in Laos. We covered sampling, it means mystery shoppers, actors, they were collecting the samples in 180 outlets in 2003 and 140 44 in 2012. And we also evaluated a new portable device for packaging quality testing in the 2012 survey. And then the results from the 2012 survey, it's been a dramatic reduction in the availability of oral artesunate monotherapy in the 9 intervening years. There is no evidence for falsification in none of the samples that we collected in 2012 versus 88% of the artesunate collected in 2003, it was falsified. But patients are still exposed to poorly manufactured drugs or ineffective drugs such as chloroquine, because 25% of the samples, they were outside the pharmacopoeia limits of the label claim. So they either contain lower quantities of active ingredients or higher quantities. So in Laos, patients are still exposed to poorly manufactured drugs, so the quality of ACTs still needs to be monitored and looked after, because resistance has already reached southern Laos. In that survey, and is also presented in the supplement, we also evaluated a portable device for packaging quality testing, and this project was a collaboration between LOMRU, that is the Laos Wellcome Trust unit, part of the Oxford University, with the Food and Drug Administration from the US NIH and the CDC. So we evaluated the device on a first phase in the Mahosot in the lab with 200 samples of artesunate, and they trained me and 2 other pharmacy inspectors with a library of medicines that we had in Laos of genuine and falsified. We had fantastic results, and the results from this preliminary analysis in the lab is already published, it's already online. The specificity was 100%, sensitivity 98%, and 100% inter-observer agreement. So we took this device that you look at the packaging of the samples with a suspect sample, and you need a genuine sample next to it. We took it with us and we analyzed the samples in the field every day when we were collecting the samples in southern Laos. And we did pick up some inconsistencies in the packaging of the samples, although none of the medicines had evidence for falsification. This has been investigated further with the different manufacturers. But our main limitation is that we didn't have the genuine comparators for 64% of the medicine samples. So there's a need for a greater cooperation in obtaining authentic medicines from the manufacturers. Many of the medicines sold in Southeast Asia, they don't come with the outer packaging, so they are sold in plastic bags. So you don't have the packaging to know the regulatory status of the samples. And other activities from WARN, so Operation Storm is also featured in the supplement from the head of the Antimalarial Quality Group, Dr. Paul Newton, and Alim Plachon from Interpol. We've been collaborating with WHO, we published these guidelines on that are called sample procedures, how to conduct medicine quality surveys in the field and market surveillance. And they'll be online hopefully soon. We started a legal surveyor, another map, to try to map all the international laws and and the penalties and how they differ between different countries. We also published a paper. We advocate for a change in consort guidelines, in the guidelines for clinical trials. We want to advocate to make sure that the medicines, they go into the clinical trials, they know the pharmaceutical origin and quality. We also have a system for delivering reference standards for medicine quality. So if people from all over the world in the labs, they want to test their medicines, we have a system for delivering the reference standards. But we also aim to continue building collaboration with the Global Fund, medicine regulatory authorities, national malaria control programs, WHO, and others. So this is the work of many people, so thank you very much.